Minister, Deputy Minister, the Portfolio Committee members. I wanted us just to have a silent reflection while we are seated down where we are. This being our first formal meeting that we have this year after the sauna, or just this year. We've had all our meetings all along wherever we have been. But number two, one of our members, Honorable Janji, Pumza Janji, is not well. She is in hospital in Durban. Number two, one of our members, Honorable Gela, has lost a brother. There's a funeral taking place this weekend in Matatiel. And the third one is our hardworking Department of Health officials in the Eastern Cape trying to save lives of those who survived the horrific accident. Quite a lot have been admitted in various hospitals, and just a quiet reflection in our prayers and thoughts for those people I've just mentioned. Thanks. Thank you very much. We can then be back. Honorable members, we have an agenda here in front of us. It starts by introductions, which we can actually deal with it in the way when we are making presentations, if you do remind, because it's just sitting there, but we are not meeting for the first time, so we probably recollect who we are. We would like to, while we're going to the apologies, indicate a request that was made after, if we could go in immediately after our apologies, number 4. I have actually thought and then consulted yesterday that we are having a very important debate brought into the House by Honorable Kwahube tomorrow. We do not have a formal presentation by the department on coronavirus update because figures keep on changing. They can do it. I was wondering if members would say, no, we don't need this unless and until we get a document, because it was something that we concluded yesterday, and therefore putting it together as a formal documentation coming here could have been a problem. It might delay. However, they are able to brief us if we could, because it's a matter of us getting to be appraised as they usually do daily. So I wanted to check with the members, because I have just been alerted that they do not have yet put together a formal presentation, but it's to pull out some of the information that they have been releasing. This is the first time we are with them in this period, so I was wondering if that we could assist some of our thinking and our processes of issues for tomorrow. But let me, you'll indicate to that if after apologies read by our secretary, you'll be ready to start with that item and then take the other ones on. Honorable Ms. Machalam, any apologies?
Good morning, everyone. The apologies, it's from Dr. Janji, who's, as the chair has indicated, she's in hospital, and Dr. Jacobs, who can't attend the meeting due to prior engagement.
May I just get a comment? Can we then start and go to the coronavirus update and just take our own notes on that and then just get going? I'm looking at this side of members. Honorable Munyai.
Thank you very much, Honorable Chairperson, I think it is very imperative that this committee be taken into confidence about the coronavirus by the minister. So therefore, I move that the minister be given an opportunity right from the beginning to share with us about the update relating to this particular pandemic.
Thanks, honorable members. If then you allow item number 5 on our agenda to still be there on discussions, it's fine. And then, though I think in our mind it was just helping us to prepare for tomorrow, but that's fine. We'll get to that. We will not restrain you if you so wish to do that. Honorable Minister, if your team can then lead and give us the briefing on coronavirus and the state of South Africa's readiness, preparedness, and responses.
Thank you very much, Chairperson, honorable members. I think as the Chairperson has indicated, we may not be having a presentation prepared. We just want to deal with highlights of the nature of the problem as it is manifesting itself. And so we would just highlight a few issues and then probably take comments and questions from the members. The issue is that the coronavirus arose from China, Wuhan city. In fact, it is said that it was picked up in the Wuhan city market. And in the process, it has actually spread to affect quite a number of people. When we first got to know of it, we were reporting about 4,500 people who were infected from China, and that at that time many countries decided to come and to evacuate their citizens from China, and it had infected people in 5 countries, wherein the World Health Organization then convened to declare coronavirus a public health emergency of international concern. This then activated all the countries to find mechanisms to take special precautions to protect their citizens. And what was of concern has been the fact that the spread was very rapid and that the death toll was actually rapidly rising. At the moment, it stands just around 3%, which while it's very high, but it actually is not even comparable to the common influenza that gives anything between 300 to 600,000 deaths per annum. The numbers of people affected to date, the figure stands at 93,000, and about 90% of all those people are in China. In fact, the number that is rising more now are those who are outside China. 2 days ago, it was spread into 76 countries. Today, the countries are 81 countries and territories. Now, territories refer to the fact that there's also a huge number of people who got infected in a ship called the Diamond Princess, which ultimately got parked off the coast of Yokohama in Japan. This was also a concern that it had many people together, 3,700, and then it ended up with a very high numbers of people infected. The total that ultimately got recorded was 706 with 6 deaths. This happened after one person had actually been found to be positive at that level. The spread of the disease is said to be droplet infection, which is an upper respiratory tract infection, manifesting in cough, sneeze, headaches, and flu-like symptoms with quite a high fever. And as a result thereof, then people who have those symptoms have actually been picked up for special screening in many countries. In China, they reported that they had over 186,000 people under observation, and that, as we've indicated, at this moment, 80,000 of them have been confirmed. The challenge that we have noticed is that over the past few weeks, the disease presentation has transformed from being one country that was the source of the infection to involve all the countries where the patients who are testing positive for the virus are found. As we say, it's 81 of those countries. We can indicate that from out of 93,000, the 13,000 are actually outside China. And the leading country there is Korea, South Korea, which has got 5,000 of the people infected. The epicenter in Korea is around Daegu province, Daegu city, which is about 300 kilometers from Seoul. There are some cases in Seoul, but there are not as many as in Daegu. It's also thought that in that area, a religious sect had a big conference, and people got infected and started spreading around the city. The numbers of deaths at in that area has come to about 33, which is also a matter of concern. Then the next country that's got also a large number of infected cases reported is Italy, which has got about 2,500 of those, with 79 deaths. Now, that's a very high number of deaths. In fact, it's the highest number outside China. Then the next country is 2,300, is Iran. Iran has had 77 deaths. Proportionately, Italy and Iran have actually got much higher death rate if you look at their numbers of infected cases. Now, the importance of all of this, of course, the last one is the Diamond Princess, which has got 700. From that one on, going to the other countries, there are less than 300 cases, and but the point concern is that it's growing in all of these. In the process, we've been worried about the fact that the numbers of people who are infected are rising in many countries who are no longer getting infection from people who have got a history of having been in China. As of yesterday, since the 29th of February, 16 countries were infected from Italy, with about 50 people already. And again, as of yesterday, about 8 countries were infected by people who have got a history of coming from Iran. And about 30 people were involved in that. And so this has led to a number of things happening, travel bans, and some of the countries stopping people coming from particular countries, and also conferences, international conferences being cancelled, particularly because those who came from Italy, some had been to conferences, others had been to holiday visits. Africa has recorded at this point about 6 cases, well, maybe 7 cases, because Egypt was the first and has confirmed the second case. Then Senegal, Algeria, Nigeria, Morocco, Tunisia have also recorded those cases. Of the 7 cases, 4 of those cases have got a history of contact with Italy. So it begins to indicate to us that this is the challenge. In South Africa, we have estimated about 3,000 people in different parts of China, and therefore the concern was a large number of students and teachers who are in the Hebei province and Wuhan city. At the beginning of the epidemic or the outbreak, we did contact them. It was not easy to do so, but we contacted them, and a number of them. On the first week, we had actually contacted the first 34 people, and they were not interested in coming back. About 33 said no. Then 1 said yes, they would come back. Then we improved the contact, and we went around talking to people. With the quarantine and lockdown continuing, the numbers have increased, and that's as a result. When we had about 130 people, and we spoke to them, and a majority wanted to come back, we then took a decision as cabinet that we need to get them to be brought back. We're working on this issue, although the number has increased now to 151. And so we're making preparations for them to be brought back. In the meantime, in taking precautions to deal with this issue, we've actually had to activate screening mechanisms in various ports of entry, starting with international airports, as well as some of the major ports of entry. And we've actually looked at where the highest numbers are, and we prioritize those, but we've actually deployed thermal screening gadgets in all the ports of entry to make sure that we use the temperature, the fever, as the first way of being able to indicate where the suspicion should go. We've tested all in all probably over 120 people at this point. We've also activated an emergency hotline wherein most of the clinicians, nurses, clinics, hospitals can call if they've got suspicions, and then we deal with it from that point of view. We've also activated the thermal screening into very highly suspicious areas, wherein on the aircraft we send teams to go in there and do temperature and direct observation of the patient's appearance to look at and identify those who might be needing further examination and tests. We've done this on many occasions, and we have not at the moment found a single South African who's testing positive for the coronavirus. There are lots of fake news that go around, and people keep around saying that they've been informed that someone is testing positive from Lancet laboratory and so on. It's all untrue, because the reality is that the laboratories that do the tests are actually the NHLS laboratories, which are government laboratories. In the process, we also do assist as a laboratory a reference center of excellence to test for the other countries, but we've also not been announcing anything about those countries because it's their sovereign right to deal with those issues. We have 2 people who have been, who are South African, who have been found to be positive, who tested positive. Those were found in the Diamond Princess off the coast of Yokohama. And amongst those, what we have is a situation where they were put on quarantine, and I think the conditions were inadequate, so that when the ship, when the quarantine in the ship was supposed to be over, they started testing other people who were not having symptoms and found probably 400 more people. And so 2 of those were South Africans who are members of the crew. They've been moved out for treatment, and they're out being treated in Japan. And in the process, they are improving. The other 10 who are also members of the crew, we have also indicated that we will ask that they should be put on quarantine, and this is going on at the moment. And they have also been tested, and we believe that those who test negative will just stay for quarantine. Those who are positive will also be treated. Once those who are positive are fully treated and are showing a negative test to the coronavirus, they will be allowed to come back on commercial airlines without any problems. And those who are testing negative and are going for quarantine, they will also be allowed to come back if they test negative after the 14 days. Those who are coming from Wuhan will be brought into quarantine in South Africa. We expect that this should happen in the next few days. And the Defense Force and DIRCO are working and finalizing those arrangements, and that they'll announce to us when that's going to happen. It's got quite a lot of logistical issues of permits and ground preparations that they've got to clear. And so when they come into South Africa, they will be taken for quarantine. We've given them 21 days because the first 14 days is just to make sure that we do the observations in line with the estimated average incubation period of the virus, and then we test them, and then we use the rest of the days for final observations and integration to society. So all of these are issues that we believe it's important for us to work together. In particular, those who are coming from Wuhan, it's important to emphasize that they are not sick people. They are not actually people who have exhibited any symptoms. There will be people who we just coming to observe, and then we'll do the test. If they test positive, we'll then move them for treatment in these designated areas. We've designated 13 hospitals in the country where emergency treatment for anyone who's found to be positive would be admitted in the way that would prepare for other hemorrhagic fevers such as Ebola and others. And so that's what we will be able to do. And I think it's important for us to send a strong message that they are not people who are infected, but of course if they are infected, we need to will be able to treat them. Our level of readiness is that we can treat any patient that would land in this country, and we have every province ready to treat such people. We have upped the game in the major ports with screening, with protective clothing for the staff, with disinfectants on the floors and the walls of the entry halls into the immigration and so on. We've also recommended that immigration officers must also be given masks, and they must also be given gloves and all of those issues. So we have to keep observing, but I think what we need to be alert to is that slowly this virus is settling in every country. The number is 81 today. I think in a matter of months, that number will probably touch literally every country. And so we need to now prepare for a much more longer term issue of resilience to deal with this situation. It's a very different challenge when you deal with it at that level. At the moment, we're just focusing on emergency response, but when you're dealing with an endemic virus, you obviously need a very different kind of response and different preparations and so on. So largely, Chairperson, that's what I would like to share. If we could leave it at that, if there are any questions, we could then clarify the members. But I do want to say we welcome the debate tomorrow, and we really hope that the members will actually, in the process, add value in the debate, and we think that it's important to bring the matter to open public interest and participation because of the seriousness with which, as public representative, we must handle this matter. Thank you.
No, thank you very much for that briefing, Minister Mkhize. It has actually, as you are closing, I could just pick up that you are saying to us, what it comes number one is personal hygiene. I mean, to some extent, a communicable disease will need that focus amongst all of us. We don't have it as yet, but we could have it depending on how we interact with our neighbors, with the world, and everybody else. Let's open this for comments and clarity-seeking questions from the honorable members. Starting from Governor Kwahube, followed by Hassan, Sokaja, go down to Mama Oshengwa, Honorable Van Staden, going to end with the Honorable Munyai. Okay, let's Chiro at the back, or come after Munyai. Okay. Start.
Thank you, Chairperson, and thank you, Minister, for the update. First, I think it's important as a committee, excuse me, that we commend the work that has already been done by the department. The reality is that this virus has rocked some of the strongest health systems in the world. And in order for us to have any chance of beating it, we need to be able to have very solid strategies in place. So I think we've got to commend some of the strategies that have been put in place. In particular, also the work of the NICD in not just serving South Africa, but serving the continent as well. Just three questions on my side. I just want to find out, the minister mentioned where certain countries have decided on travel bans. Is that something that the executive is considering? If so, what would trigger something like that? Excuse me. And then the second question is, you spoke very much around there will be a need for long-term resilience strategies. And so is there any strategy from the department in particular in involving the private sector in ensuring that, you know, we try and have partnership we needed, because we are lucky now that we don't have any confirmed cases. But considering how quickly this could spread, can we lean on some of our private sector partners? Is that a possibility? And yeah, and then if we can maybe just have a sense of how far along are the long-term resilience strategies sort of being, what's the planning sort of phase at the moment? Thank you.
Thank you, Mr. Chair. I've just got a few concerns. My first concern is that we have various videos going out as an education campaign to residents or to people from different countries. But as South Africans, if we got an education campaign in place to advise South Africans, you know, how, what, why, and when. You spoke about the hotline, but I don't think most South Africans are really aware of the hotline. Have we got anything constructive that we're putting out there to South Africans? Two is that we talk about personal cleanliness and so forth, which is all well and good, but I'm just concerned that some of our public health facilities don't have sufficient running water. And God forbid if anything has to break out and a patient has to go to these hospitals, how are we going to cope? And thirdly is that we know there was insufficient N59 masks, you know, in place. How do all public facilities do now have those masks to properly protect our professional staff?
No, thanks, Chair. I think I also need to thank the Minister for the detailed report. Chair, I've got only one question. In the report, the Minister indicated clearly that South Africa doesn't have any signs of the virus. My concern and question is around stigmatization. What is there any signs of stigmatization from people that are coming from China? And if any, how is the department managing that issue of stigmatization? Thank you.
Thank you, sir, Minister, and House. First of all, one will thank the Minister and the Department for the work they have done all these days, a few days, while they have this pandemic of disease. Thank you, Minister. Mine is more or less same like Ishmael, because now I see this disease need the awareness to the people. Moreover, even here in the parliament, one would not know how to clean, how to escape in this disease, but we need the awareness and the emphasis of the hygiene. I thank you.
Then it would be Munai and with Shirwa after.
Thank you, Chairperson, and thanks for Minister being here this morning. I've watched all the press conferences the Minister has held so far. I think it was up to 3 since the 28th of January. And the measurements the Minister announced in the first press conference is very good measurements, which was tabled on that day. The question, however, that I have on that is, will that measurements the Minister announced be in a good managed and good administrated by the Ministry and the Department? And then, Chairperson, this virus is a very serious matter at this stage, and as the Minister has indicated this morning, more and more countries are getting tackled by this problem. So we as South Africans must not be too relaxed about this thing. There's scientists in the United States, however, who reported last month that in a year's time, more than between 40 and 70% of humanity can be infected by this virus. So this is a very serious concern and a very serious matter, and I think we must take it very seriously. However, I see that France yesterday announced that they've made a temporary ban on events with more than 5,000 people in an effect to stop this virus from spreading. Are we going to do that as well? And then the Olympic Games seems to be cancelled later this year. But that brings me to a question with international sporting events inside South Africa and outside the borders of South Africa. I think, isn't it time that we also put a temporary ban on that as well to protect our athletes from South Africa, from going there and people coming here to get the virus or to spread the virus? So that's some measurements we must look at. And then the other thing is more and more countries are in the process of closing their borders. And the minister announced in his first press conference on the 28th of January, he was talking about how weaker borders we have in South Africa. The measurements he put on the table that day for the airports and the harbour ports is very good. I must admire him for that. But I still have a big concern about our borders between our neighbouring countries. The minister himself said that it is a we've got this weakest borders, and it's a bit of a problem. So I just want to know how far are we looking as South African government onto that matter, and to handle it effectively. Then on the 13 hospitals the minister have announced also on the first press conference, I just want to know, are these hospitals now ready? Because some staff members in that hospital say to some members of the media that they don't even know how to handle this crisis. So I just want to know if preparedness, are they now done? Is the staff informed what they must do, how they must do it? And is all the quarantine areas in that hospitals in good order to go on? And then on the press conference the minister held this past Sunday, he was talking about the quarantine areas, but I think South Africans need more information about our quarantine areas. And it's not necessary to go, we must play open cards with the public out there, because this is a very serious matter. We can't say, and with all respect, Minister, what you said on Sunday, you announced that there was quarantine areas, but as a matter of security, you wasn't prepared to avail any more information. But I think I'm really concerned about this thing. We must play open cards with our public out there and tell them what is going on. And yes, I think it's not for anyone to go there, but the security measurements must be very strict around these areas. But we must know where it's going to be, and South Africans must know where it's going to be and where it will be. And then the other matter I have is the fake news is going around on social media. How the South African government is going to handle that matter. Because everybody is sending out recipes and do this and take this lemon and with that water and take this vaccine. We're laughing now, but it's a big problem. And everybody is getting up in arms about this thing because people are scared. They don't know what to expect. And I think that from a minister and the department, we must set out, there was at the beginning clear info about how to wash your hands and cover your mouth and all that thing. But I think it must be done on a constantly basis. Actually, at this stage, I would say on a 24-hour basis. Do this, do that. And to keep the public alert onto that through the media. That must happen. I just want to check it, Chair, something if I haven't missed something. Oh yeah, and the matter of the hotline the minister has announced on Sunday. You said on Sunday it's only now operating between 8 and 4. When will it be 24-hour basis constantly? Don't you think it's time to run it now, from now on, already 24-hour basis? And then all scientists around the world are busy working to get a cure for this virus. And I would like to see that this government is giving more money to our scientists here in South Africa to help to get this cure available and to get this cure so that we can start with processes in South Africa. Thank you, Chairperson.
Thank you very much, Honorable Chairperson. I think let's welcome the minister's report, as well as the department as a whole, for proactive work they've done since the outbreak of this coronavirus. Key issues, I must say that from the standpoint of view, we have confidence into government, or rather the state, rather than the private sector. South Africa, I think yourself, Chairperson, Honorable Chairperson, you were reminding us at some point that South Africa was the first to combat Ebola outbreak here, amongst many countries in the globe. So we have confidence in South Africa's systems and capabilities, And I'm sure that's why most of the South Africa's doctors are poached to work in various countries in the world. So we have confidence in our country, in our capabilities, in our scientific research development. Of course, because we're part of the continent and the globe, again, globalization would not just move goods and services across the globe, not only move passengers, but also move pandemic. So it should be known that if part of the global community, the spread can go on and so on. But I think we need to appreciate the fact that in China, the infection is in the decline because of the intervention and also the measures that they've taken to combat this or to reduce infections, rather. So, of course, I would say that their right to know, Honorable Chairperson, must also be linked with the right to privacy of the patient or the affected members. So the right to know should not supersede if I'm sick, if I'm infected. So therefore, I don't think it is important. It will be regarded as untransparent or not transparency if you don't disclose the area where you're going to locate those that are infected. And I'm sure that area should be regarded as national key point, because the nature, the military involvement and all sectors that we've indicated should be declared that way, because otherwise you'll find the area flooded with journalists than the families or than any other people that are supposed to lend support. I think that is very much important. I'm not anti-journalism. It should not be taken that point. So I think the fake news, how do you combat fake news? Fake news also start amongst ourselves, because we're trying to politicking around the life of our people. We're trying to play politics on something very sensitive and close to the heart of South Africans, which in my view we shouldn't do. Even in tomorrow's debate, I hope will uplift the life of our people and the collective combat to this pandemic with seriousness, vigor it deserves, without underplaying and propagate false news ourselves. So it's not something we should not play, should not play games about, Honorable Chairperson. I should say, the ministry, I think, we welcome that they designated the hospitals to deal with coronavirus. I must say the hospital of Tembisa in Gauteng, where I come from, it have running water. In fact, the hospital of Ekurhuleni, which honorable member was complaining about water, and me, that hospital of ours have running water in Tembisa, and it's ready. Thank you very much. And I think also, Chairperson, I'll also further propose that we consider, as the collective portfolio committee of health, do oversight trip at the OR Tambo port of entry as the collective. It's a proposition I'm trying to put forward for consideration by the members. It is very imperative because I always believe on collectivism rather than the unilateralism. Thank you very much, Chairperson.
Honorable Chirwa, last one.
Thank you, Chairperson. Thank you, Minister, for the breakdown and the feedback on what is going on. I have a few questions here, clarity-seeking questions. The first one is, I know about the Tembisa Hospital. I want to know if there's other intervention centers that have been set aside by the department, and also the criteria of deciphering or deciding what is readiness. I'm asking this question because we already have situations or circumstances where people go into hospital having had or having been in a car accident and leaving there with TB because of infrastructure, of overcrowding and all of those things. How will that then be maintained or sustained in the case where we have to face or confront the COVID-19? And also the issue of regulating domestic transport systems, especially in poor areas like townships and rural areas, where people can't necessarily take a day off because they've got symptoms of coronavirus. And then it easily spreads in taxis and buses and trains. Has there been a strategy by the department to confront the issue from that perspective? Should that happen? Or should we be faced with an issue of COVID-19? Symptom management strategies for the working class. Oh yeah, I spoke about that. And the issue of racist stereotyping and propaganda machinery that's happening, and how it will affect the people of South Africa, in the sense that there's a misconception that the coronavirus, well, it is dangerous. We can't dispute that, right? But the fatality rate is at 2% so far. In fact, the seasonal flu is worse than coronavirus because the fatality rate is at 10%, right? So now how do we manage the stigmatization and the propaganda that has been waged against us? I mean, I myself already am a victim of that. I couldn't believe it. I was working at the airport and I came across somebody of a particular race wearing a mask, and I jumped, right? And I'm a public representative. And I also saw another public representative who happens to be a minister wearing the wrong mask, tweeting about it. And I'm like, we are going to a very dangerous place if we are going at this rate. And it's going, we are putting people in panic, and we don't even have the means to manage that panic, right? So we have to draw a line between hoping for the best and preparing for the worst. For example, when I did, so I'm coming to another question now. When I did oversight at Mamelodi Hospital, ne? One of the healthcare workers there told me that they've dealt with Ebola cases in that hospital, right? And I'm like, how? But this has never been reported by the department, ne? That there's been Ebola cases at Mamelodi Hospital. And I mean, I understand, because I mean, imagine the trigger it would cause to xenophobic attacks if it were to be reported in a very volatile country like South Africa that, yo, there's Ebola in Mamelodi, right? So how do we draw the line of informing people of what is happening, and also managing triggers that our country can possibly face from different, in particular the coronavirus issue. So yeah, also about disseminating information in schools, in clinics, in parliament. How has the department managed the issue of disseminating information of how this emergency call center functions, of who can call, what the number is? Because there hasn't, I mean, we have to admit there hasn't been much done. If you don't have Twitter, you are in the darkness. And if you don't have data, you are in the darkness, even worse. You have to rely on the 30-second clip on the news every night to know what's going on around the world in regards to coronavirus. And I don't think we should be leaving it at that. What has the department done to strengthen information systems around this? And yeah, And beyond here, you know, when I was doing this oversight, né, when they told me that they've had Ebola cases, they told me it's because temperature is something that can be managed. Like a person can manage their own temperature in the sense that this is what I'm being told. I may be wrong, or the person may have unnecessarily triggered me, right? She tells me that people, when they cross the borders and they have Ebola, they take a lot of Panado to manage their temperature so that when they pass the screening, then their temperature is already regulated. So are there any screening processes beyond temperature control at our airports? Yeah, that's all. Thank you.
Can I just ask, when was the story about Ebola?
It was early December or late November last year.
The last request from Honorable Kela to come in.
Thank you, Chair. My apology for raising my hand very late after we have noted hands. Let me also welcome the report from the Minister. Indeed, you are doing a good job as a department. Since we heard about this virus, and we've been all around working very hard, which as a portfolio we must really appreciate that the department is not silent regarding this virus. But also the other mechanism that we can use, members, the department have people who are working, especially we do have people who can do awareness campaign. We've got several people like environmental practitioner who always go to school and educate about hygiene and also what can be done. Already the message, Minister, is being spread across the country about this virus. And also we do have volunteers, ward-based volunteers, who always do door-to-door in every ward. They are volunteers from the Department of Health. The other issue, Minister, that I want to raise, I know prevention is better than cure, and already the department has organized. Yesterday, I saw also at the airport, when you enter, people were wearing the mask and also gloves to make sure that the department has already started to make sure that it protects our community and also the staff who are working around the airports. But also the other issue, Minister, that I want to know, maybe a clarity or a suggestion that don't we have maybe something that will help us, or maybe injection or something to prevent, I don't know, because it's a new disease that it just happened now. Anything so that you can be affected, I don't know. But I know that at least the department, as we know that South Africa is the best in terms of making sure that health standards are very high to protect the community. Even during the Ebola, Minister, I know in some other years, where I come from, there was a person, a family that visited other countries and they come with Ebola. The department was very, 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 very good. Even when we attend the funeral, there were measures that people must not attend, only those, and they were wearing protective clothes to make sure that those who were going to bury that family, they were not also affected by the Ebola. So I'm very confident that the health department will do all the best to make sure that our people are not dying regarding this virus. So in that case, Minister, I'm having a confidence. I will request that as members, let's work together with the department, because we are also part of the department. The main fact that we are serving in the health department, let's stop being negative But let's try also to make sure that we communicate with our people very good instead of being negative. So that will be my request, because even the Bible said during the end days there will be disease that are not curable. But we need to pray to say, God, have a mercy on us, because we are your children. Whatever that we are doing, let's come together and make sure that we fight and we defeat this disease. Thank you.
Back to the minister and his team.
Thank you, Chairperson, honorable members, Minister and Deputy Minister. Thank you for the questions and the interest. I think this issue is probably going to occupy us for a long time, and I think many of the issues relating to this remain unanswered from a scientific basis, and I think we'll probably find answers to some of them as we move along. Chair, on the question about the travel bans, we've looked at that. And I think that needs to be weighed up against other matters. So, for example, the US had stopped flights directly from China. However, in doing so, those from China that wanted to travel to the US then simply used alternative airlines that would connect them via some other route. And the risk there is that you then you don't know your risk, and everyone then becomes your risk. So, for example, if you have a flight coming directly from a particular area, you can then focus a lot more energy on trying to manage that risk than having your risk dispersed and thinking that people could be coming from many other places that could have connected. So it's about trying to think about that, and the WHO's recommendation is not to do travel bans at this stage. I think it's also fair to also appreciate that in doing travel bans, you may affect other sectors. So, for example, as you may know, the pharmaceutical sector, a lot of the active ingredients come out of China. And if you're going to be doing these travel bans, it's going to affect the supply of medicines into countries because there's movement of individuals between countries. So I think we need to think about that and balance the risks and the benefits of doing it. Chair, in terms of the private sector, we have a committee that manages the response, the policy type responses to the coronavirus, and that committee is called the M0 committee. We activate it immediately when there's an infectious disease of this type that's been identified by the WHO. On the M0 committee are representatives from the private sector, from the hospitals, GPs, etc., participating. And they then link up with their representatives, and through that mechanism we then have dissemination of information and an agreement about how we'll manage the disease. So from a clinical management perspective, the private sector is very much on board. We've been doing training with GPs as well as with the private hospitals so that we agree about how we're going to manage. If there's a shortage of something, we then see how we assist each other, etc. As well as the laboratories, so that we can get information from each other as that happens. So at this stage, for example, it's only the NICD that can perform the COVID-19 test. However, they're now trying to train the private laboratories to do that so that we have greater capacity in the country to do that. In terms of the long-term resilience, Chair, the M0 committee is active whenever there's an infectious disease outbreak. So when Ebola was, the outbreak was high, the committee gets activated. When it was MERS, when it was SARS, etc., they become active immediately thereafter. So we have this committee together with the Emergency Operating Center at the National Institute for Communicable Diseases, which I think the Minister announced previously. So this grouping, when there is an outbreak, so assuming that we identify somebody that is positive somewhere in South Africa, this team will identify who these persons' contact was and immediately identify them, isolate them, and move them to an area. So there's a massive team that you may have seen it on TV, and that's their role. And they've been doing this. They did this for listeriosis as well. So that team will do that if that happens. So they're very much ready, watching the space to understand when that risk will arise. In terms of education campaigns, Chair, I think we've put out a lot of material, but maybe the media by which we're putting it out is the difficulty, and we need to reach people in different ways. So if you go onto the website of the NICD, we've produced videos, a video about symptoms, a video about treatment, a video about contacts, about personal hygiene, etc. You also see that we have frequently asked questions there. We also have information about what is this disease about, how do we diagnose it, what are the risks, what type of mask you'd want to use, those kinds of things, so people understand all of that information. But I think I take the point that maybe we need to reach people differently through different communication channels. So we'll produce this material in a way that maybe people can access it much more easily. Chair, on the hotline, there's two hotlines. One is for doctors, and the other one is for the general public. So the doctor hotline is 24/7. So doctors call in, we get lots of calls on the two lines probably take about over 100 calls a day from doctors saying, I have a patient in front of me, I want to understand whether this patient's at risk, and then the team there then take them through the issues. The hotline that's operating in office hours is one for the public to ask questions. So I think we also have an email address where people can send questions through, but we can look at maybe if we need to expand that. The 13 public facilities that we've identified, the individuals, they have been trained in infectious diseases. They've been trained by the NICD. They've also been trained by the WHO. They have protective gear in place. The clinicians there are very familiar with managing infectious diseases. In fact, when we heard on Sunday, I think it was the News 24 journalist was saying that Klerksdorp Hospital was not ready or something like that. And then we contacted the person in charge, and he was quite surprised that somebody would say that, because he's very much responsible. I think sometimes people may not know in a hospital that you've got 1,000 employees and you ask somebody about this, you may not know that there's a unit and there's people who have a dedicated space. The infectious disease is managed in a dedicated area. There's isolation, there's negative pressure, etc. in place so that these issues don't lead to the spread. I think personal hygiene is critical, and one of the things we need to do more of is having the hand washing sanitizers all over, because that's the best thing we can do for ourselves to prevent the spread, because the organism, I mean, basically would be destroyed by that. The issues around readiness, I think the one question was, how do we know we're ready? So the WHO gives guidance to every country about what they know about the disease, what's the best thing to do. They then produce a guideline, and we have a checklist out of the guideline. So we've gone through the guideline, and there's a team that went for training with the WHO, and now we've gone through the checklist, and we've basically done all of the things that we need to do at this stage. We obviously don't have an outbreak in the country. When we do, then we need to do the other things that are recommended within the guideline. The guideline changes all the time as well, because as we learn more things about this virus and how it presents and how people respond to it, we will have to amend our plan in line with that. So we keep looking at that. Chair, on the question about the screening processes, the guidelines at this stage indicate that temperature screening is probably the best thing you can do, because anybody who is manifesting with temperature, usually within the first 2 days, they will have some manifestation of a high temperature, even though they may be asymptomatic otherwise. So they may not have a cough, they may not have excessive mucus production or any of those other things, but they will have a temperature usually. That's the earliest indicator. The difficulty with the other diagnosis of this condition is that you need the best diagnosis is a pharyngeal swab, and getting the sample of the pharyngeal swab the first time is not easy, and so that's why you'll note that when the people that are in quarantine go through serial swabs, just to make sure that the first time if you missed the organism, you'd get it the second time, because sometimes the organism may not present in the pharynx as early as you'd like. But that doesn't mean you're not infected. It may be sitting in the cells and it doesn't replicate yet for whatever good reason that it does that. I think in terms of the airport, we have been working with the officials in Port Health to make sure that lots of measures are in place to identify and prevent anybody who may be potentially infected. There's an isolation area there, and people will be put into isolation. We've now also given some protective gear to officials in Home Affairs as well, because they come into close contact with individuals, and Customs as well has been in contact with us because they also sometimes stop individuals, go through their luggage, etc. And so we've provided that to them as well. Thank you, Mr. Ostrovsky.
Yeah, I'll just comment on a few matters. Just on the issue of, I think the acting DG has touched on the use of private sector. Just to say that indeed we look at primarily that the public sector should be the mainstay in terms of providing the service. But as we have done in other public health emergency situations, if it comes to a stage where in one particular area, at this stage, because we haven't, it's more of anticipation. But in the event that there is cases, and in any particular area of the country, if our public health facilities become overburdened, we will definitely engage with where there might be resources in the private sector as well. So that is given. Just in terms of the skepticism about whether we are ready, and one of the honourable members mentioned about the shortage of water in some hospitals and so on. I think sometimes maybe we should not conflate the normal burden of capacity of our public health facilities in terms of the volume of a burden of disease, the demand for services, which is an ongoing matter which we battle with in terms of making sure that there is adequate services. But when you deal with a specific emergency, which is what the coronavirus is, here it's, there are very specific guidelines in terms of what is it which you need to be able to provide. It doesn't mean that your normal challenges go away, but you can't say, because in some of the facilities we still have long queues, there are challenges in terms of infrastructure, and therefore that means, because of those chronic challenges, it means we cannot be ready to handle a public health emergency. I think that's where some of our colleagues conflate that, because there are very specific guidelines in terms of isolation, in terms of guidelines for treatment, and you have to make sure that in the event that this kind of public health emergency arises, you should have a facility which is dedicated to make sure that that can be handled. And we hope, like other previous public health emergencies, that when those do arise, it comes in manageable volumes, so that our facilities will be able to manage that. But as the Minister said, in terms of this particular disease, there is a pattern which suggests that down the line, this may actually become an endemic disease, just like your normal, your influenza. And when that stage arises, you turn into a different mode, because now you move from an emergency to a situation where, this is almost like an endemic disease. And maybe although the comparison may not necessarily be exactly the same. If you look at where we came from on the HIV, on managing HIV, in the early days, it was like isolated, oh, there's an HIV found here and so on. And then people were grappling around how to manage it. But as it became more and more an acceptance that this is now becoming endemic, it's not an isolated matter, we also had to change tune and have a situation where a lot more people now are trained right up to primary health providers, and they're able to do health education, get involved in screening, and also in terms of management. So we have moved from a situation where about 15, 20 years ago, you would have had about 5,000 people on antiretroviral treatment to today where you've got 5 million people. So in terms of your change, so in the event that this kind of virus also may change into a situation where from an emergency end up being endemic, you're going to change your tune in terms of the kind of, even the protocols, in terms of how you're going to manage it. The last thing which I want to comment about is one of the members mentioned about stigma. That's one of the things which we are concerned about. It's one of the things we are concerned about because there's, part of it being, as they say, little education can be very dangerous. Limited information or little education can be very... So you get a whole lot of things which people are fearing about, and therefore we do need to we agree on more public education exposure. If you look at the evacuation plans, which the Minister has spoken about, which you have confirmed publicly that this is now being undertaken, despite the fact that over and over again we emphasize the fact that the evacuation is aimed at healthy South Africans who are trapped in an area of an epidemic, the epicenter of the epidemic, and who have been in a lockdown for almost 2 months, and that is the basic reason why they become frustrated, they become anxious, and all sorts of anxieties then set up, and that's why after bearing with the situation over a 2 months period, from a situation where the demand for evacuation was 1 or 2, 3 people, and now almost everybody in that area, because they've been sitting there in their rooms unable to move around for 2 months now. And despite the emphasis on the fact that this is an evacuation of healthy South Africans who are in that epicenter, so that they can then, according to their own wishes, be moved to their home country and be quarantined for the period which is required. And once that period has expired and there is no virus detected, they can be free to be with their families. Notwithstanding that, the rumor mongering out there is the Department of Health and the government want to import the coronavirus from China and come and risk the whole 57 million for the sake of 150 people. So that's the kind of thing which I think, with the assistance of honorable members here, and I hope also from the debate tomorrow, it will help to dispel that myth that indeed this is South Africans who are healthy, who are trapped in the epicenter of the disease, and all that we want to do is to give them an opportunity to get out of that area, so that, once the epidemic has passed, those who want to go back to education or work, they can be able to do that. I'll stop there.
Thank you, Chairperson. Thank you very much to the members. Your comments are very helpful. And of course, some of the questions you raise are important also, because we don't just deal with them as questions, but we also realize the areas that need to be given attention to as we deal with the public. So we appreciate your comments about the work that's being done. The issue of travel bans has been addressed. But I'd like to ask the members, let's hear your views. What do you think? Let's hear your views, because, you know, I was trying to correct the media. They say, oh yeah, you're sending mixed messages. You first say we're not evacuating, now you're evacuating. No, we are assessing the situation on a day-to-day basis. And we take the views into account. So I think the members must just raise your views. Let's hear what you think. There are many things to take into account. The hospitality industry is very worried that we might take decisions that might affect them. Other than being arbitrary and just decide you will not have so many people meeting and so on, what should we use as criteria? You know, yeah, let's get your views there, because it's an issue that basically is about looking at the best. We will be discussing with the ministers. They will give us a number of indicators as to what they're seeing and what they're hearing and what their concerns are, what they think we need to deal with. So I think we would be very much welcoming to those views. I think the issue of private sector has been addressed. Right now, there's a platform for collaboration, and we can deal with all of that together. You only test for coronavirus in the public sector. You don't have anybody doing that. But we've seen a lot of stories around people who went to a doctor and they told them that. We're currently investigating others who are saying they're being charged by private doctors for this and so on, so on, so on. We will just follow that up. But we believe that you need to close the ranks between public and private so that you don't end up with people falling into the cracks. The issue of resilience, I think the Deputy Minister has dealt with it. We have to, it's an evolving process. So where you are today is not where you're going to be tomorrow. It's going to be something that we're going to build on as the situation arises. We accept the issue about the educational campaign. We have to deal with those. I'm not sure about no clinics with no water. I just asked to check this now. 3,467 clinics. 3,128 of them have constant, reliable, available water. Where there are challenges are on the 10%, and that becomes an unstable supply in some of them. And so when we deal with a challenge, I think we must deal with it on the basis of the average. The bulk of them don't have the problem that the member is raising. Where there are those problems, then you're focusing on a specialized minority that needs to be given special attention. Sometimes when we articulate, it would not sound like that. It would sound very much like there's no water in the clinics. Yet, in fact, the issue is that we have to deal with the fact that there will be such areas, but they are not necessarily the majority of cases. With the story that went around was that China manufactures the largest number of masks and export them into the rest of the world. And the story was, and I'm just saying this just for context to say that the interviewer said that China used most of the masks that it produced and started importing back the ones that it actually exported. Now, if China can face such a challenge, really, who are we? You know, so I think we must put a context as well that when the demand is high, there will be shortages here and there. We haven't run across that yet, but if that were to happen, it's not only that, by the way, that's going to be affected. We're looking at other issues where there might be challenges in the whole pharmaceutical production area, which we have to keep in mind. So we're going to have to keep an eye on that, and I think that we're watching the space. And again, the Deputy Minister raised the issue of stigmatization. It's very important. The fake news as well is where we're going to have a problem. And you must look at what comes out on Twitters. And I'd like to ask if these members, can we, for example, for once just mount a campaign amongst ourselves as members of parliament, mount a campaign where we actually try and dispel fake news. Just for the sake of South Africa. We just take one stance, all of us, and say we want to deal with this issue of fake news. and the quickest way of dealing with fake news, and we are dealing with them, so the quickest is to just send us a note and say, there is this thing, is this true? When we say, yes, it is true, then you say it back, okay, this is true. And we say, this is not true. We send back, we say, it's not true. Because we can actually be a lot more influential together if we can deal with it like that. If there's anything that's going to be a big problem here, is fake news and stigma. That's the biggest thing. The virus, with time, it will be managed, as you would have seen what the case of China has indicated. And you can't overemphasize hygiene, Mama. Mashasha, we will always need to emphasize the issue of hygiene. And it's the basics. And so you are quite right there. I also want to agree that we need to focus on all these measurements. It's one thing to announce. It's another one whether people are consistently implementing them. And that again is the responsibility of the members as well, to go around and say, but we see that there's a gap, this is not happening. We go back there and deal with it. We're picking up lots of gaps and we want to deal with that. 50 to 70% will be infected. Of course, this virus, you're not going to have any way to stop it from getting into every country. So I think that's what the point they were making. More than 5,000 people, travel ban, stop those things. I think, give us your views. Let's hear what you think. What do you think should be happening? We spoke about the borders. To be honest, members, I don't believe that you've got so many people who are infected who will come from neighboring countries. It might be the other way around, actually. There will be more people from South Africa who will have landed in our ports, who might then end up going to the other countries as well. I think we must just be aware that this is a disease you can't control, and you can't, beat your chest and say, well, we are cleaner than everyone else. Again, the question of the media finding someone in the hospital who say, I don't know anything about it, then the department is actually lying. They are not ready. I think it's an exaggeration that we must try and contextualize. Each time we see that there's a gap in information, we make sure that we go and intensify that. It takes a while. People are not concentrating on the same thing at the same time, and not everyone is doing exactly the same thing. So it's something that we have to just keep working on. Quarantine area. I'm going to actually pull out the. I'd love to give the members some of these tweets, because I think the members must actually look at them. What can we do to try and encourage people not to be as hostile when we talk about this? I think that's one thing we have to measure when we deal with the issues of venues and what information you want to give. After all, no one is actually welcome in the quarantine site. So it's good to know where it is, but you're not going to go there. So you can't even go there as a member of parliament to go and do oversights. You'll never come out. So let's see what information, right, whilst the issues are being worked on, and once are finalized, we'll see how much information is possible. And then, I think the issue of the hotline going 24 hours, it only will happen once we get a case. Before we get a case, they will not be 24 hours. That's how the whole situation works. We are on an alert. As soon as we think we've got a case now, we have to go on to contact tracing. We jump into that mode. And so right now we do contact tracing, but we're doing it, in a targeted way. We use, so if, for example, we find someone, like you sitting in this way, if you're sitting in an aircraft, and that particular passenger had a suspicious look, then we'll take all of your numbers around. We'll track you after that. We phone the people and they say, are you well? Are you fine? Until we get the results. When the results are fine, don't worry. We will not bother you after that. So we are looking at all of those issues. And I agree, we need more funds for research, and this is where global collaboration is going to be important amongst research communities. I think, again, the issue about globalization involving the spread of disease is correct. And that's why I think we must be very clear. This idea of saying, well, it's Chinese, it's people from such a country, and so on, these foreigners, it's a misleading concept because the virus doesn't look at your nationality. It just looks at whether it can get in, and that's it. So we must also help to make sure that the thinking of our people is not to think, yeah, man, these Chinese are bringing this virus. Actually, if you sit here today, there are, I was looking at the US, for example. Of the imported cases, a bulk of them would have come from Italy and from the Diamond Cruise, Diamond Princess Cruise. The number that came from Wuhan is 3. 45 came from Diamond Cruise, Diamond Princess. They were not Chinese, they didn't come from China. But that's what it means. So I think your point's important. Also the issue of us avoiding getting ourselves into fake news is important. And I also think when we try and contextualize our problems, we mustn't make statements in a way that demoralize the staff in a facility when we're actually generalizing and are not really being specific about what we found as a problem. So I think we need to look at that. But I do agree, oversight, yes, it's acceptable, it's good. We will always welcome that. Basis of hospitals designated, these are hospitals that have got capacity to isolate and ensure barrier nursing care and make sure that you can actually treat a patient without infecting all the others around. That's the approach which we take. As the Deputy Minister was saying, it doesn't mean that you don't have a long queue. It doesn't mean you don't have other problems, but this capacity is limited to a particular environment. So we have that. Issue of transport. Right now, that issue doesn't arise. It will arise when we now have to deal with an open infection all over the country. So we'll have to look at how we deal with those issues at that point. I think we have part of these resilience strategies that has to come in. You were talking about the scare with people wearing masks. You know, I don't know how many times we've said that there's no one who's got an infection in South Africa. But every time somebody's wearing a mask, we get a big scare. One time people were landed, about 6, 7 people landed in Cape Town with masks. Oh, Twitters were up bars, we've spotted coronavirus and so on. So we need to find a way to reduce that kind of panic. Again, members here have to really take that responsibility together. And now, Mamelodi and Ebola in December. Who? You know, I think I must give you my own number as well. No, I don't know your number, so if I miss your phone, I can't tell it was your phone. By the time we're done, I'll have 16 missed calls here. So if it's
I actually text the minister. I can even show you a recent text from like 2 weeks back. The minister and the deputy minister don't answer their texts.
Yes. You know why? That's because you'll have, right now, you've got 999 calls that might not have been answered. The numbers are not clear. So you can't tell between the first and the 150th number who was that. So you may not be able to catch up until you get the number recorded, and then you know, oh, MP Shira phone. The number of members, slowly we'll get to see that, because each one of the members, as they phone and we can pick up, then we can store the number. Then next time you phone, we know who has called. And that's really what happens. Many of the members would have suffered from that, and it's got nothing to do with whether the questions are answered. You will only answer them afterwards. And if the number has not been stored, you run into a problem. And that's what happens. So I'll get your number. Then in future, somebody tells you there's Ebola in Mamelodi, let's talk. Because the real problem is that people on the ground will tend to panic and share stories to you as members of parliament out of concern. And it's not necessarily that they want to mislead you. But if they think there's Ebola, they'll talk and say there's Ebola. A few times we've had people who we rush into a hospital and say, check this one, and we don't make an announcement into the media. Then they go and check this person. About a day or so later, we say that there's no coronavirus. Then we say, okay, take the patient out. In the meantime, those who saw the patient running into there, they say, yeah, we've got a case of coronavirus in our hospital. They send the messages around. They are just panicking. We just need to be able to stabilize them. And if we can talk about it, yes, it will be possible. So those messages that come and I don't have the number, I miss them. And when I find the number, I will then be able to get back to the member. And we mark them. So it's not possible once we've got somebody's name entered that we will actually fail to respond. But it takes a while. If we didn't enter it immediately, I can have a lot of messages which will go in there and I will not be able to deal with them simply because I can't cope with them, but also I don't know it was you. But when I check, the numbers which have got names already are easy to deal with. But I think it's important that when people raise such serious issues, you should, as a member of parliament, be able to say, let me check, and then come back and say, no, don't worry, it's not Ebola. Or don't worry, there might be a patient there, but that patient has not been tested positive. Once it's tested positive, we'll announce, and then we'll tell you if it's announced, and therefore you will know. Then people will panic, but they'll still know that when they come to you, they'll get the correct information. I don't think we must blame people for that. People are normal. Everyone is worried. This coronavirus is serious. If you see the numbers of people who are dying and everybody is sitting here and looking at what's happening in China, no one is going to relax. Everybody's going to sit there and say, oh my goodness, what's going to happen to us? And the one thing that's a problem is when there is a fear that something is happening and we don't know. And that's really what's hitting all of us. Now, one reporter was asking me, you've got 80,000 people in the whole world who have got this thing. And Africa is saying we've all got 3. You guys are undercounting. I said, no, we don't have them. Don't wish for them if we don't, because the same way that you test the first one is the way you test the 150th one. So these are the concerns that we must just be able to deal with. So yes, we are upping the game, honorable members, in the airports as well, and so on. But we're also putting pressure for provinces, for regional hospitals to be alert, because we are saying that a person might end up in a remote clinic. We should still be able to pick that up and bring them into the system. Honorable Chairperson, I think that, oh, by the way, you raised the issue about Ebola funerals. When you get to this kind of level, there are certain drastic steps that sometimes get taken. I was just looking at what happened in China. The restriction in the deaths in China, strict policy involves incineration and minimal number of people attend. You're right. So you've got a very large population there. So what do you do to try and restrict? So there are things that we have to discuss and talk about what are the best approaches as we deal with these things going to the future. We've really got to talk about it ahead of time so that we don't have to be fighting over an issue where we could have actually shared views and try and align the approach and then move on, because nobody's got information, enough knowledge about coronavirus. We're going to learn as we move along. There are things that we'll teach people, there are things we're going to learn from others. So that's the approach. Chairperson, thank you very much.
No, thank you very much, Minister, for that briefing with your team. Just to add on that, we are in constant contact with the Minister regarding our plan to visit OR Tambo Port Health, and we're just waiting for a response and also an acknowledgement from AXA. We're planning to go there this Friday. As to which time of the day also depends on the logistics, because we do not want to come and overwhelm our staff, Port Health officials there who must take us around and show us. But we would have loved to have gone there before the debate tomorrow, but nevertheless, this information also will still be very handy to us as honorable members. So I have already received indications from members who would want to. We will communicate with you, honorable members, as to what is the slot of us, probably not more than 2 hours in that vicinity, so that we can allow staff members to continue checking the flights as they arrive, but that is thanks to the minister who has also been helpful to facilitate that. May we take a 10 minutes comfort break? That will be inclusive of tea. There's fresh tea that has just been brought in now. I would wish that you participate on that tea because I'm checking here, that is your last refreshments you have for the day. At 1 o'clock, we must finish the meeting and rush to some other meetings. So 10 minutes for comfort break, including Honorable Van Staden. You're also part of the 10 minutes. Don't prolong it longer. Okay, thanks. When we come back, we go straight to the presentation of NHI Evaluation Pilot Site Report.